February is National Cancer Prevention Month, and medical professionals will tell you awareness is just not enough. We all must take steps towards early prevention and detection. Joining us this morning from Ironwood Cancer and Research Centers are medical oncologists Dr. Monique Chang and Dr. Cherington. Great to have both of you with us. I want to start with you, Dr. Cherington. When we're talking about cancer prevention, I'm sure a common question you get asked quite a bit is, what causes cancer?
Well, when thinking of cancer prevention, it's important to know what factors lead to cancer. The highest risk factors are lifestyle and environmental factors, which account for 70 to 90% of malignancies. Diet alone accounts for 30 to 50%, and infections about 15 to 20, and hereditary risk factors tend to account for about 10% of malignancies. Thus, cancer prevention should incorporate diet, lifestyle modifications, as well as screening techniques. We have some information that shows that at least 40% of malignancies are preventable by modifiable risk factors.
Yeah, let's talk, Dr. Chang, about some of those risk factors, specifically diet. How much of a role does that play in a cancer diagnosis?
Diet does play a role in affecting the risk of cancer development. Red meats, we know, do increase the risk of colorectal cancer. We also know that processing foods with salt or fermentation does also increase the risk of cancer, such as nasopharyngeal cancers. We also know that dairy has a positive effect and can decrease the risk of colorectal cancer. So I think in the end of the day, we just recommend eating red meat in moderation, as well as dairy in moderation, and also increasing things like our green leafy vegetables, beans, as well as fruits.
Yeah, and Dr. Cherington, you touched on environment. We love the sun here in Arizona. It's a big part of our lives. Talk specifically about how environment can play a role in a cancer risk.
Well, living in Arizona, we are one of the highest incidents of skin cancer in the world, and in fact, in the last 30 years, we've seen a significant rise in skin cancer rates, possibly due to the deterioration of the ozone layer. So it's very important to limit your time in the sun unless you're having plenty of SPF lotion and reapplying that frequently.
Yes, and I know Dr. Cherington and Dr. Chang, you talked about early screenings. How important are those screenings?
Early screening is really important. We know that with the screening tests for breast cancer, such as mammograms, colonoscopies for colon cancer, pap smears for cervical cancer, and rectal exams, along with PSA testing for prostate cancer, all help us detect the cancers sometimes in early stage or precancerous stages, which has increased survival for patients.
What about vaccinations? Do they also play a role in cancer prevention?
Vaccinations do help as far as cancer prevention. One good example is the human papillomavirus vaccine, which has decreased the incidence of some head and neck cancers associated with this virus, as well as cervical cancer.
Yeah, and Dr. Cherington, I'm feeling there's a theme. A lot of the times we can control our cancer diagnosis by prevention, early prevention.
Mm-hmm. Yeah, exactly. There's a lot we can do. Diet, caution on the environment, and then early screening.
Yeah, all of those factors come into play. Well, thank you both for being with us. Great information. And we want to give all of you some information this morning. Ironwood Cancer and Research Centers, they have 10 Valley locations for your convenience. If you would like to book an appointment, please call 480-821-2838 or visit the website ironwoodcrc.com.